So just to re-emphasise the point the Minister said about people being patient, it is going to take us many weeks to get through 1B, and while some GP clinics are coming online next week, they won't be releasing appointments till they're sure of their vaccine deliveries, which are coming in the next day or two, and they'll progressively release appointments. So please don't badger your GPs. Be patient. Take your time. Everyone in 1B will get vaccinated in coming weeks, but it'll take a while for this to scale up. So we're just asking people, by all means, go into the website, look at that eligibility checker, see what clinics are available now, and if yours isn't available now, it may well come on later on. But take time. We're not in a hurry in Australia. We don't have a burning platform, as I've said on many occasions. We can take our time to do this vaccination properly. Next slide. Well, we've got that slide up now. So basically 1B, sorry, go back, my fault. Who will be vaccinated under 1B? So we know that healthcare workers now are right across the healthcare sector included. Some are in 1A, the rest of them are now in 1B. We are including the household contacts of quarantine and border workers, because we've now vaccinated the quarantine and border workers almost completely in 1A, but the household contacts represent another ring of containment. As we have seen in the last few months, the real risk to Australia now of COVID is from quarantine introduction. There are a range of critical and high-risk workers currently employed, particularly meat workers. We've known, for example, that the meat industry is a high rate of transmission of COVID, and clearly for many emergency and other workers. But the critical thing that Minister Hunt's just announced now is from next week we are starting our general population age cohorts. So this is the first time we've gone broadly but within an age cohort, and we're starting with the over 70s and over 80s, and that's why we have chosen a primarily GP-led primary care rollout, because this population generally would like to get vaccinated close to home, and as their GP clinics come online, most of them over the next 4 weeks, they'll be able to access them. But be patient, as I've said. Aboriginal and Torres Strait Islander people over 55 or 55 and over who have a higher risk of being susceptible to COVID, and a range of people, and there's information on our website, with specific underlying medical condition, including people with significant disabilities. So, for example, people on dialysis with chronic renal failure or severe chronic lung disease, and a range of conditions. In many cases, the GPs obviously will be well familiar with those chronic conditions. Next slide. So, the most important thing, if there's any concerns about whether you're eligible in Phase 1B, go to that website that the Minister showed earlier. It has a very good eligibility checker, which is easy to use. Or if you're not confident to use internet or website, you can ring that helpline that was put up before and talk to someone, and they can talk you through all of the options, your eligibility. If you're not currently eligible, you can register, as the Minister said, and you'll be sent a notification. And even if you are eligible, it may not be possible to make an appointment for some weeks. Be patient. The appointments will increase significantly as the number of clinics roll out over the next month. And you can keep going back to the eligibility checker and the clinic finder if there's no appointment currently available, and just check at another time. So finally, there's been some in countries in Europe, and obviously some interest in Australia about vaccine safety. Professor Skerritt will talk about this issue in more detail, but it's important to note that when you're vaccinating a very large number of people, as we've seen in Europe, you will get events that may be seen by some people to be associated with the vaccine, but you need to very carefully and safely analyse the data. And I think it was very important that the European Medicine Agency are now looking at the data related to clot. All of the evidence that we have seen suggests that there is no increase above what you'd expect in that population, in the vaccinated population, of these thrombotic events. But clearly there's anxiety when you've got new vaccines, and we understand that people want to be cautious. But we are very confident in Australia that those incidents that have been reported in Europe, and people have taken a highly precautionary approach, that they are not a significant issue. We've not seen any issue at all to suggest that there is a higher increase of stroke. But Professor Skerritt can talk more about that as well. In terms of the recent concerns from Queensland about anaphylaxis, we know that vaccines have an association with anaphylaxis. Between 1 in 10 per million people with all vaccines can have an anaphylactic reaction. There are components of vaccines that produce anaphylactic reactions. People with anaphylaxis will generally know they've had it in the past, and our ATAGI advice has always been that people with anaphylactic reactions, or particularly to vaccine components, should be vaccinated under medical supervision with a doctor present in the facility, and they should stay for longer, for 30 minutes rather than the recommended 15 minutes. Again, sometimes you do see a greater than what might be expected incidence of reports. These will be investigated by the TGA, but there is, to my knowledge, no reason at all for concern. We've seen anaphylaxis with the Pfizer vaccine, we've seen a smaller number with the AstraZeneca vaccine, and they've all been expertly treated. We expected to see anaphylaxis. All of our vaccine clinics are prepared and have adrenaline on hand, and they know how to manage this condition. So we are very confident that our program should continue to go ahead as it has. I've had the AstraZeneca vaccine a week ago, and more than a week ago now, with Minister Hunt, and I'm very confident that this is a very safe and very, very effective vaccine.